you have to ask the doctors or the counseling person to confirm whether this cost is covered in the package what you have mentioned. On the welfare of both IVF centers and as well as the couples, my concern is please make sure do it mutual convenient. So now we are entering into the 13th topic above no IVF and ICSI end to end, or say no to IVF and ICSI. In this step, this is a very crucial step and we have to be very careful. This is about, the topic is IVF and ICSI package and cost. Earlier on the first intro topic, I have spoken about the success. I have sidelined the package and cost, mentioning that it will be given as a separate topic, and that topic has now come. So now we have to understand this IVF and ICSI has become such an emotional subject, and so many centers have started offering these treatments. So now it has become little competitive, and there are so many advertisements and promotions, and it is all happening. IVF at 69, ICSI at 89, IVF at 99 inclusive of medicines, and it becomes so much of competitive and so much of pricing variations. Pricing mismatches are there. So the couples are really confused which to choose. And in my opinion, I always tell, keep your financial cost as second and give preference for the success as a first preference. So always keep this in your mind before choosing the IVF center. Just because some centers are giving some good packages, good cost reduction, good negotiation or good discounts, if you feel so, there is some diminishing, there is some lack in the transparency or sharing of records or explanation or counseling or whatever it is. See, money matters, but now there is too many IVF centers across the country and across the globe to offer these treatments, and we have wide choices. Take your own call and choose the center, but before choosing the center, take a very detailed analysis. As far as this IVF ICSI cost and package is concerned, because there is no fixed ways of giving this mentionings, everybody have their own practices. Some people include the medicine cost in the package. Some people exclude the hormones and treatments in the package. So there is lot of variation in the packages. So I will give what are all the treat cost involved. You keep a note of it, all this cost involved, so that you have to ask the doctors or the counseling person to confirm whether this cost is covered in the package what you have mentioned. That is what is needed. Say for example, when you are going to start an ICSI procedure or when you are going to start the stimulation, the first and foremost thing you have to ask is whether you are doing IVF or ICSI. If this package offered is only for IVF, what is the cost for ICSI? Number one. If the treatment, the cost for ICSI is being mentioned and IVF is lesser, I would strongly recommend you in the current world, I would say, because of the cost cutting, don't choose IVF, because there are so many other additional income expenses that is going to come in the pipeline, which can be taken a call without compromising the outcomes. Do you understand? So, but definitely for sure, please choose ICSI as your choice rather than IVF. There are few centers who have not started this ICSI, who don't have a competent embryologist or who don't have a setup, ICSI setup is there with them. Then we have no choice. Knowingly, they are doing only IVF, go and do the IVF. But otherwise, choose ICSI. And because of cost cutting, don't choose IVF, number one. Second, the stimulation. I told about the stimulation elaborately in that stimulation charter. Whether what type of FSH injection. Choose the recombinant FSH of Indian type at the competitive price, to be maximum around 20 to 30,000 rupees for 10 to 12 days of stimulation along with the agonist or antagonist medications. That is second. Number 3, they are going to do stimulation scan. Number 4, they are going to do semen backup for that 1 week during in case of emergency, if the male partner doesn't turn out or unable to give the ejaculation sperms on the time of egg pickup. Number 5, egg pickup procedure. Theatre cost is involved. IVF lab cost is involved. Embryologist fees is involved. Gynecologist egg retrieval procedures charges involved. Drugs and disposables is involved. anesthesia charges is involved, embryologist drugs and disposables is involved. So all these things you can keep a note of it. Find out whether these are all covered in this package what you have mentioned, or these are all anything separate. And then embryo transfer OT charges and the drugs and disposables. On the same time, you are going to do some freezing of embryos. What is the freezing cost? Embryo freezing, I have elaborately discussed about the freezing cost in whether it is cryo container wise or cryo locks, or it is based on the number of embryos, monthly, quarterly, half yearly, yearly, whatever it is. Take a detailed analysis, take a detailed understanding about the embryo freezing cost. Then embryo transfer preparation cost, ET preparation cost from day 2 till embryo transfer preparation, and embryo transfer happening in the theatre charges, and the embryologist IVF lab charges, and the clinician charges. If you are need to stay post embryo transfer for 2 weeks hospitalization till the pregnancy result is received, what is the cost involved? So I have mentioned close to around 20 points. If you want, you can repeatedly listen to this and note down those points, and check with the center wherever you are going to undergo the treatment whether all these concepts are involved. End-to-end treatment, there is no hidden cost. Everything is covered in this IVF ICSI package. Then it is, I'm understanding, I'm having clarity, but always better for both the IVF center as well as for the couples. Keep everything transparent and documented. Take a copy of whatever it has been declared and keep it with you for your understanding, because there should not be any word of mouth acceptance and a small conflict. Say for example, a chain of centers are there. Sometimes branch staff would have given some commitment which would have been not honored by the head office or something. So many conflicts will happen. Better always, even if it is a single center or a chain of center, take everything in documentation, the package and cost, because you have been taken for the consent. For each and everything, the consent has been obtained. It is for the safety of the IVF centers they are doing that. Same way for the safety and the welfare of the couples, they can disclose this and you can retain a copy of it just to make sure there is nothing is been added to the cost. My one concern is there is a clarity. There are only two types of treatments. One is elective treatment and second one is emergency treatment. And emergency is nothing but a fracture, emergency surgery, chest pain, brain injury or bleeding in the brain or something, emergency surgery. You have no choice to think. You have to mobilize the funds and get it done if there is no something, an insurance or some facilities are available. On the other hand, treatments like this IVF, ICSI, they are all elective procedures. So you can take your own time. Doesn't mean you are delaying your age. You have to understand it if it is involving a financial investment, and that should be under your purview. If you are able to afford it, please go forward. If you are not able to afford, then please think it over. My concern is during the treatment, you should be comfortable, you should be pleasant, and should be volunteer yourself and be happy because you are looking for a baby for your future. That is a real true happiness. That is a purpose of having this life. In that situation, if you are going through some compulsion and mobilizing funds out of stress and strain, will it be of good use for you? And will you be wholehearted to undergo these procedures when such financial burden adds to you? Definitely on the welfare of both IVF centers and as well as the couples. My concern is, please make sure, do it mutual convenient. The centers try to bring down the cost to the average and unaffordable couples, and if they are really having some affordable couples or overseas clients where they can spend some money with the comfort, let them spend. But if there are couples who cannot afford, we have to do some sort of leverage for them to make the treatment complete without compromise by giving some value adds. This is my opinion. So I hope you have got the clarity about IVF and ICSI and how to take it forward, and what are all the treatments involved and what are all the costs involved, so that with this understanding, when you are starting your IVF and ICSI protocol, you will have a real financial investment and move accordingly. So let's meet on the 14th topic.